Bone and Soft Tissue Path Review Part 1. Feel free to pause the video to give yourself time to answer the questions. What ethnicity is granular cell tumors most common in? Granular cell tumors are most common in African Americans. In general, granular cell tumors are most common in the third and sixth decade of life and are twice as common in women as in men. What is the reactive change that can be associated with granular cell tumors? Cutaneous and mucosal lesions can elicit an epithelial hyperplasia, which may be pseudoepitheliomatous. This hyperplasia can be a mimicker of squamous cell carcinoma. What are the granules made up of in granular cell tumors? The granules are made up of lysosomes and autophagic bodies. Because the granules are lysosomes, they are CD68 positive. The granules are also PAS positive and diastase resistant. What immunohistochemistry stain is useful in making the diagnosis of fibromatosis? Beta-catenin. Redistribution of beta-catenin from the cell surface to the cell nucleus is prominent in fibromatosis. STAT6 is a helpful stain for the diagnosis of this soft tissue tumor. Solitary fibrous tumor. This is because solitary fibrous tumors are associated with the NAB2 STAT6 gene fusion. What is the name of the benign proliferation of fibrous tissue associated with extravasated red blood cells? Nodular fasciitis is distinguished by haphazardly arranged spindle cells in a myxoid background with an accompanying capillary network and extravasated red blood cells. What fusion is characteristic for synovial sarcoma? SYTSSX fusion transcripts due a chromosomal rearrangement between a portion of the short arm on chromosome X and a portion of the long arm of chromosome 18. What sarcoma typically stains for CD99? Ewing sarcoma. What translocation is seen in the majority of cases of Ewing sarcoma? A translocation between EWS1 on chromosome 22 and FLY1 on chromosome 11. Sarcomas typically stain with what markers? Melanocytic markers. What two fusions are associated with alveolar rhabdomyosarcomas? Fusions involving FOXO1 and PAX3 and PAX7. Which fusion associated with alveolar rhabdomyosarcoma has a worse prognosis? The fusion between PAX3 and FOXO1 has a worse prognosis in alveolar rhabdomyosarcoma. I hope you enjoyed this video. To get updates when similar videos become available, please consider liking and subscribing.